Welcome to this YouTube channel. In this video we are going to talk about 10 things you didn't know about the Pfizer COVID vaccine. So before starting this video, like this video, and subscribe to our YouTube channel for future updates. You may have a lot of concerns about what this means for you and your loved ones now that the Food and Drug Administration, FDA, has granted emergency authorization for the first coronavirus vaccine, with doses now being delivered. So far, here's what we hear. Number 10. Which coronavirus vaccines have been authorized by the Food and Drug Administration? On December 11th, the FDA approved an emergency use authorization, EUA, for the Pfizer-BioNTech coronavirus vaccine for people aged 16 and up. Emergency clearance is not the same as complete FDA approval. Pfizer will continue to research the vaccine's safety and effectiveness until it has adequate evidence to seek final clearance. On December 17th, the FDA's Vaccine Advisory Committee convened to review Moderna's Phase 3 clinical results for its vaccine. The panel voted to recommend that the COVID-19 vaccine be approved for emergency use. In the coming days, the FDA is expected to officially approve the vaccine. What are the coronavirus vaccine's reported side effects? Preclinical and clinical trials are used to assess the efficacy of each coronavirus vaccine. The following are the most frequent side effects associated with coronavirus vaccines that have been approved: injection site discomfort, tiredness or weakness, headache, body pain, chills, knee pain, fever, injection site swelling or redness, nausea, feeling unwell, swollen lymph nodes, lymphadenopathy. These side effects usually last 1 to 2 days. The majority of patients have mild to moderate symptoms, but some people may have more extreme symptoms. Number 9. A few people who have been given the Pfizer-BioNTech vaccine outside of the clinical trials have had severe allergic reactions following vaccination. According to the FDA, people who have had a serious allergic reaction to some part of a coronavirus vaccine do not get it. Furthermore, patients who had a strong allergic reaction to the first dose of a 2-dose vaccine do not administer the second dose, according to the CDC. Number 8. How many individuals in the United States have been vaccinated against COVID-19? The number of people who have been vaccinated against the coronavirus in the United States is yet to be determined. Pfizer-BioNTech has a deal with the federal government for 100 million doses of its vaccine, which is enough to vaccinate 50 million people since 2 doses are needed. After the FDA released an EUA, healthcare workers around the country got the first doses of this vaccine on December 14th. The government has also put a pre-order for 200 million doses of Moderna's 2-dose vaccine, which would be enough to protect 100 million people. As soon as the FDA releases an EUA, Moderna's vaccine will be delivered to the United States. Number 7. You can rely on our help before you get through this. You need to be able to turn to professionals who can help you improve your emotional well-being in tough times. We're here to help you. Right now, who will get the vaccine? Since the number of coronavirus vaccine doses will be small at first, states will have to prioritize who gets vaccinated. The CDC's Advisory Committee on Immunization Practices, ACIP, voted to propose that healthcare staff and occupants of long-term care facilities be vaccinated during the first round, according to trusted source. The Kaiser Family Foundation notes that while states are not obligated to obey this recommendation, most do. Few states have a more comprehensive vaccination plan for healthcare employees, with people who are at the greatest risk of contracting COVID-19 being vaccinated first. This first wave of vaccines has involved law enforcement, people imprisoned in jails, and people housed in homeless shelters in a few states. The ACIP will meet again later to determine which groups in the next round should receive the vaccine. Other critical staff, the elderly, and those with chronic medical problems are likely to be affected. Number 6. Where can I get the vaccine? The vaccine would initially be used in nursing homes and other long-term care services, as well as clinics and military bases. The vaccine will be distributed by CVS and Walgreens clinics to long-term care centers. Vaccination will be available in pharmacies, municipal clinics, physicians' offices, and mobile clinics as more vaccine doses become available. The Pfizer-BioNTech vaccine must be held at very low temperatures until it is safe to use. As a result, this vaccine will only be available at locations that have this kind of advanced freezer. The Moderna vaccine must also be kept frozen before it is used, although it can be kept in a regular freezer. Number 5. How much can vaccination cost? The federal government has pledged to make the coronavirus vaccine available to all Americans free of charge. Many health insurers are required by the Affordable Care Act, ACA, to completely fund all federally prescribed preventive care, like vaccines. The CARES Act, which was passed this spring, mandates insurers and Medicare to provide preventive treatment 15 days following a vaccination advisory committee report from the CDC. Aetna and some Blue Cross Blue Shield programs, for example, announced earlier this year that they would not charge patients for the vaccine or its administration. For Medicaid enrollees, states must completely fund the expense of the vaccine and its administration. Uninsured patients that are vaccinated may petition for insurance from a government provider relief fund. Despite these safeguards, certain patients will be required to pay for the vaccination, or a provider may bill for administering it, which excludes those that are protected by health policies that were in place prior to the Affordable Care Act, also known as grandfathered plans. Any of the ACA's provisions are not applicable to these proposals. Should women who are pregnant or breastfeeding have the vaccine? Many vaccinations are suitable for women who are pregnant or nursing. Source you can trust. However, neither the Pfizer-BioNTech nor the Moderna coronavirus vaccine clinical trials involved pregnant mothers. As a result, we can't say for sure how effective the vaccine will perform with this population or whether there will be any adverse effects that weren't shown in the earlier Phase 3 clinical trials. Number 4. A reproductive and developmental toxicity analysis of Moderna's vaccine in rats was sent to the FDA. There were no negative side effects discovered in this research. Pfizer told the FDA in its UA meeting that results from its own report will be released shortly. Until the vaccine may be evaluated in a clinical trial in pregnant or breastfeeding people, this form of research is needed. The CDC notes that whether or not pregnant women receive the coronavirus vaccine is a personal decision trusted source. A mother having vaccinated is also not considered to pose a risk to a breastfed child, according to the CDC. Pregnant women should speak with their doctor before receiving the coronavirus vaccine, according to Dr. Emily Adhikari, Assistant Professor of Obstetrics and Gynecology at UT Southwestern Medical Center in Dallas. This entails balancing the benefits and costs of vaccines against the risks of contracting COVID-19 while pregnant. Number 3. Adhikari, who is also the medical director of perinatal infectious disease at Parkland Health and Hospital System in Dallas, recently co-authored a thesis in JAMA Network Open. Women that became infected with the coronavirus during pregnancy did not have an elevated chance of having a bad pregnancy, according to this report. However, the risks to both mother and baby are important for the 5% of COVID-19 positive pregnant women who get really sick, and it's difficult to guess who it would be, she added. Women who refuse to be vaccinated should also exercise caution. Pregnant women should be vigilant to uphold healthy habits, like social distancing, hand-washing, wearing a mask, and avoiding big crowds, Adhikari added, because we don't know anything about the impact of this virus on long-term health. Number 2. Can immunocompromised people get vaccinated? In its Phase 2/3 clinical trial, Pfizer involved certain people with controlled HIV infection, but evidence from that subgroup is not yet available. According to the CDC, people who are immunocompromised will have the coronavirus vaccine provided they don't have any other medical conditions that might prevent them from getting it. Since scientists aren't sure how effectively the vaccine protects people with compromised immune systems, they can also take precautions to avoid coronavirus infection. Number 1. Can children get the vaccine? 16 and 17-year-olds are included in the UA for the Pfizer-BioNTech vaccine. For people aged 18 and above, Moderna is demanding an UA. Both organizations plan to do research on younger students. Kids under the age of 16 would not be allowed to get vaccinated before they are done. Potential hotspots: prisons. According to the National Commission on COVID-19 and Criminal Justice, correctional facilities accounted for 19 of the top 20 clusters of reported COVID-19 cases in the United States as of mid-August. Positive result rates were 4 times higher than in the general population. According to Dr. Charles D. Lee, president-elect of the American College of Correctional Physicians, conditions in jails are ripe for the novel coronavirus to spread rapidly. He told Healthline that jails are overcrowded, and prisoners live in close quarters and are unable to socially distance themselves. Some of the structures date from the 1800s. There is a lack of ventilation. Inmates age in prison, their bodies deteriorate, and they also have underlying conditions, such as diabetes, obesity, and epilepsy, according to Lee. Nearly 250,000 inmates have tested positive for COVID-19, according to the Marshall Project. Almost 1,700 people have died. San Quentin, in Northern California, may be the poster child for how a prison epidemic might go wrong. COVID-19 has infected over 2,200 prisoners, with 28 of them dying. When the infection spread across the facility throughout the summer, San Quentin authorities set up giant tents in the prison yard to attempt to isolate the infected prisoners. A judge eventually directed the state to free or move 1,500 prisoners. What do you think about this video? Do let us know down in the comment section below. If you enjoyed this video and want to hear from us again, be sure to hit that subscribe button before you go.